Hi, my name is Avantika Subhash, and I will be talking about the kidney, mainly the description, position, syntopy, and the birth defects. Now, to talk about the basic description of the kidney, we know that they are bilateral organs located in the posterior abdomen. Therefore, they are retroperitoneal organs. Now, they extend from T12 to L3, and we should keep in mind that our right kidney is placed relatively lower to the left kidney due to the due to the position of our large liver. Therefore, the extension ranges from T12 to L3. We also know that we have our adrenal glands that are located superiorly above both the kidneys. And based on a physical description, we know that they are bean-shaped and they are medially more concaved. Now, to talk about the covering of the kidney, there are mainly four layers that surrounds the kidney. Now, if you're going from innermost to outermost, we're going to start with this purple layer that surrounds the kidney alone, which is known as the renal capsule. And this is mainly a very tough connective tissue that mainly holds the vessels to the hilum of the kidney. Now, this renal capsule is surrounded by a layer of perinephric fat, which is also known as your perirenal fat. And this fat is what holds the position of our kidney at its location. Now, this perinephric fat is surrounded by a layer of fascia called as your Gerottis fascia, also known as your renal fascia. And this fascia is what holds not only the kidney, but also your suprarenal gland. And then finally, we have our outermost fat, which is the paranephric fat, also known as your pararenal fat. And this fat is mainly located towards the posterior lateral region of your kidney. Now we will go to the segments of the kidney. Now this is a very easy part, obviously, and we have 5 segments. We have superiorly, you have your apical segment, then inferiorly, you have your inferior segment. Then your anterior segment is divided into your anterior superior, which is the yellow part, then your anterior inferior, which is your red part. And then finally, you have your posterior segment, which is relatively smaller compared to your anterior segment. Now, when we go to the functions, we have our 3 major functions, which is your homeostatic functions, plasma filtration, and its productions. Now, when we come to the homeostatic functions, like it says, it just tries to balance, the kidney just tries to balance out the concentrations in it, which is your water concentration, mineral concentration, and your electrolytic concentration. It just makes sure that it's completely balanced and it does not increase or decrease. Then you have your plasma filtration, which occurs within the renal barriers. And then you have your production, which it mainly produces your major 2, which is your renin, which, as we know, that it controls your blood pressure and its volume. And then we have our erythropoietin, which we also know that it helps in your hematopoiesis, and which is technically production of your red blood cells. Now, this is a basic structure of our kidney. Now, we will begin with its 2 major layers, which is our renal cortex and our renal medulla. Now, renal cortex is the outermost part, and then renal medulla is the more inner part, which consists of your renal pyramids and your renal columns and your calyxes. Now, to begin with your renal column, it's the part that extends from your renal cortex to your renal medulla. Then they are located between your renal pyramids. Now, below the renal, a little more lower to your renal pyramids is your minor calyx, which then extends to this blue region called your major calyx. Now, from the major calyx, you can see this pink region called your renal pelvis. And this is more like a cavity that holds your urine that is collected from the kidney. And then it connects to this yellow region, which is our ureter, which then takes to the rest of your urinary system. Now, we are going to talk about the syntopy of the kidney. Now, this is relatively much easier. And so we'll start with the anterior part. So on both left and your right side, you have your suprarenal gland located superiorly. Then from your left side, just when you think about it, you know that there is your spleen, your stomach, your pancreas, and your descending colon. And then on your right side, you have your liver, duodenum, and your ascending colon. Now, the posterior part, even more easier. It's the same thing on both the sides. We have your diaphragm, then you have your 3 muscles, which is your psoas major, quadris lumborum, and your transverse abdominis. Then you have your 3 nerves, which is a subcostal, iliohypogastric, and your ilioinguinal nerve. Now, the only difference is the ribs, which is on your left side, the syntype is your 11th and your 12th rib. And then on your right side is your 12th rib. And this is mainly because, like I said, your right kidney is relatively lower to your left kidney. And since the left kidney is higher, it consists of, it it collides with your 11th and your 12th rib. Whereas in the right side, it's right kidney, it's only your 12th rib. Now, finally, we will cover up the basic birth defects to know about your kidney. Now, we have your major four, which is your congenital polycystic kidney, renal agenesis, and then renal hypoplasia, and then abnormal location of your kidney. Now, renal agenesis is mainly when your kidney, when the kidney is developing, there is one kidney technically missing. It can also be a situation when there's bilateral, where both your kidneys missing when the development of kidneys occurring. Then renal hypoplasia is where during the development of a kidney, one kidney is your normal physiological size, whereas the other kidney is relatively smaller in size. Then you have your abnormal location of the kidney, which is your horseshoe kidney and your pelvis kidney. Horseshoe kidney is where during the development of the kidney, as you can see in this picture, both the kidneys are fused together. And where now pelvis kidney is where the kidney during its development is unable to go back to its anatomical position, which is relatively higher. Therefore, one kidney or sometimes both the kidneys are located in your pelvic region. And that's technically, it's not, as we know, it's not an anatomical position of the kidney. So this is just what you have to know. I feel you have to keep in mind the basic scheme of your syntype of the kidneys, both anterior and posterior, and get to know the basic structure of the kidney. Thank you so much.